Good morning, everybody. It's July 8th, 2024. I've decided, with the encouragement of a close friend, to start making some videos regarding my journey with Sinonasal Adenoid Cystic Carcinoma. It's a very rare type of cancer that originates in the maxillary sinus behind the cheekbone, but it's it originates mostly. The symptoms originate mostly in the nasal canal. Um, so I'll just start out with my first symptoms. In January of 2024, I had a small scab inside of my nose, and the it was just real small. I thought it was an ingrown hair or maybe a pimple, but my nose started running very rapidly, and it wouldn't stop running. That occurred for ongoing for probably 3 or 4 weeks. And I just thought at that point that I had a pretty serious cold or that maybe it was a sinus infection. It wasn't until um, probably the end of February, beginning of March, that I realized that I was developing a small lump on the outside of my nose, about right here, but it was pretty small. I also started experiencing some pretty dramatic weight loss, and probably a 30-day period, I lost about 20 pounds. Um, and that's when I started to get really concerned. After the, the month of losing weight and the growth starting to get larger and larger, I decided to go to an urgent care because I didn't have a primary care physician at the time, and that primary care physician diagnosed me with or the um, urgent care diagnosed me with an ear infection and kind of disregarded the symptoms that were going on in my nose with the what I perceived as a sinus infection. Um, so I uh, I was prescribed an antibiotic. I went home. The antibiotic really had no effect on me, and it wasn't until the beginning of April that I went to the emergency room because the growth started penetrating down the inside of my nose, and I could internally see the inside of my nose was almost completely clogged. I couldn't breathe out of the right side of my nose, and the lump on the outside of the nose was getting bigger and bigger, um, pretty drastically. So I went to the emergency room. They determined at that hospital, because it's a small local hospital, that they couldn't really do anything, so I was referred to a major hospital about an hour away from where I live. I was transported there via ambulance on a bed-to-bed transition, and once I got there, I was probably in the ER for, I don't know, close to 6 hours before I saw an ear, nose, and throat specialist. And they weren't 100% sure what the problem could be, obviously, probably because of my age and my symptoms, but they could obviously see the growth inside my nose and said that there's the potential that it could be a benign tumor or it could be a cancerous tumor. So they did a sample of the tumor that evening, and I also saw an eye specialist because the tumor had started to penetrate the corner of my eye slightly, and it was slightly affecting my vision, but not horribly. Um, so they took the sample. I was admitted to the hospital that night, and um, everything seemed to be going okay. I wasn't in a tremendous amount of pain yet, um, but they did admit me to the hospital just to wait for the sample to come in to see what they needed to do moving forward. So the second I was in the hospital, um, I was sitting up and I started sneezing, and then all of a sudden I could feel something squirting in the back of my throat, and I spit up and I realized it was blood. And at that point, I called a nurse in, and she gave me a bucket, and I filled the bucket about a quarter way full of blood over about a 20-minute period, and the bleeding just would not stop in the back of my throat. I was They contacted the ICU department, um, and I was told that I was going to be put under and intubated, so that they could go in and hopefully cauterize the tumor, but they weren't sure at the time because sometimes internally they're not unable to get to the actual location based on the location of this tumor. It's they have to be very careful as to where they go in, what they do, because of the potential damaging effects it could have on the other parts of the body or of the face of the brain. So they brought me up to the ICU. They put me under, brought me up to the ICU. I was in intensive care for 7 days, intubated for 7 days. I woke up to a tube in my throat. Um, and when you're intubated and you have to come off the breathing tube, you have to breathe at a certain level for so long before they'll pull the tube out to show that you have the capacity to breathe on your own. And it was probably about 6 hours of the breathing tube in my throat of me having to breathe every so many minutes to a certain level before they could get that tube out. Finally, once they got the tube out, um, fortunately, I had a lot of support there. My mother was there, my father was there, my stepfather was showing up periodically, um, and my mother's twin, my aunt, was there as well. Um, so I did have support in the room, but I was extremely scared um, because I just felt like I could not breathe. But after they finally pulled the tube and I could breathe on my own, it was about a 3 day period of me spitting up blood to clear out my lungs and my throat. Um, and finally, after that process cleared, I kind of felt back to normal. Um, they had to do another biopsy because the first biopsy that they did was not large enough. Um, so they did the second biopsy while I was intubated. So unfortunately, I didn't have to experience that or feel it. Um, and then I was removed from the ICU about 2 days after the tube came out, put on a regular floor, and I sat on that regular floor for maybe 6 or 7 days. And then just being observed. My biopsy came back, but unfortunately, the hospital that I was at, this is such a rare form of cancer, they could not determine the type of cancer that it was. They had a general suspicion, but they couldn't determine the type. So they had to send the sample to Sloan Kettering in New York City um, to make a determination as to exactly what type of cancer that was. In the meantime, I had no real reason to continue to stay in the hospital. The bleeding had stopped. I no longer um, was in a tremendous amount of pain, and so I was released from the hospital with a follow-up appointment to meet with an oncologist 2 weeks later. I had met with several people in a treatment team while I was in the hospital, the oncologist. I briefly met with a radiologist. I met periodically with the ear, nose, and throat specialist and a neurologist. Um, and they were kind of trying to work together as best as they possibly could to figure out um, how to approach the situation. Um, for now, though, I will leave it at that. I will keep you updated, or I'll update you again in the next video moving forward to tell you kind of more about how that journey continued. But as of today, keep the peace. All right.